Hi guys. So I wanted to talk to you today about the foot surgery, okay? I really wanted you guys to know this because I got foot damage, not foot damage, nerve damage. Now, when you go see your podiatrist and you've exhausted all other measures, when you have tried steroids, the anti-inflammatories, the stretching, the doing everything that your doctor asks you to do, and you're still in chronic pain and have chronic issues with your feet, a lot of times they may say, what about surgery? For me, it was me who was pressing the issue about surgery. So I'm telling you guys because you may feel like this is not getting any better. This is getting worse. I'm doing everything. I'm trying the steroids. I've done the anti-inflammatories. I've done the injections. I have done everything that I could possibly do. We need to talk about surgery. Let me tell you something before you do that. Okay, now when I had my surgery, I had issues that happened after, and I know that my doctor explained these issues to me. He did, and he said that some of the things that can happen are, if you have the surgery, you can develop more scar tissue. You can get nerve damage. You can get both. And I'm sure that there was other things that he explained too, but I was so desperate for the surgery and thinking that this surgery was going to resolve everything that I said, okay, now come on, let's go. What are we doing? Let's do this. Get me a date ASAP. And I planned for the surgery date. The surgery did not resolve my issues. I would find out later, and thank God that I was on time off because of the surgery, or I wouldn't have known to do these things. But let me tell you something. So the fibroma, that pain still has not gone away, but it's more manageable. I still got an injection in the fibroma, so maybe that's what's also making it more manageable. But it is manageable. I'm walking again. That took a really long time, and maybe because I'm older, I'm 49 years old, and I don't know if that makes a difference, but the recovery time just took a lot longer than what was expected. They told me 3 weeks non-bearing weight, 3 weeks bearing weight, and you should be good to go back to work. When I talked to my manager, she had said, oh, that takes 2 months. You'll be back in 2 months. And I was not back in 2 months. My recovery time took a long time. But this is what I learned during my recovery time. Like I told you before, there are so many videos on YouTube about physical therapy. You can look up Michigan foot doctors. You can look up Bob and Brad, physical therapists. You can look up Ask Dr. Joe. Those are the 3 main channels that I follow. And I tell you, I was so frustrated with seeing all these videos talking about get relief in 30 seconds, get relief in 30 minutes, all these quick fixes. Well, let me tell you something. When you've been suffering from chronic pain in your feet for a long time, and I'm telling you, since 2014, I had been suffering, but the last couple of years that I had this issue going on with me was the worst pain of my life. It was the worst time of suffering in my life. So since 2014, so chronic, okay? I swear I thought it would never go away. I cried when it was time to put weight on my feet. And I waited 2 months because I just felt like I couldn't do it. Like, something with the surgery. I just had issues after my surgery. And one of those issues is nerve damage. I did get that. And the doctor told me, and I was so desperate that I said, just do it, just do it. I needed relief from that pain that I was feeling all day long. Every time I got up from sitting down, every morning that I woke up, it was more excruciating in the morning. So I know how you feel, but I promise you, please listen to me. Before you get the surgery, look up physical therapy. What worked for me were the calf raises, the toe raises. You're literally getting up on your toes and just lifting your body weight, lifting your body weight, lifting your body weight. And then the arch crunches, okay? Those two did miracles for me. I wish I knew about this before I had the surgery. I had done stretches, mind you. I was doing my stretches dedicated, devoted, every day, morning and at night. I woke up an hour early doing my stretches. The stretches were good, but the calf raises and the toe crunches were what the arch crunches. I mean, when you crunch your arch like that, that was what gave me more long-term relief. And I tell you that these last 2 weeks that I have been doing these exercises. Now, mind you, it's been since my surgery, but the last 2 weeks, and I have been completely dedicated 3 hours a day since I want to say 6 weeks ago, okay? When I didn't feel relief after my surgery, and I tell you that I cried because I still felt the pain when I walked. When I dedicated myself to the physical therapy and doing it every day and devoting myself to physical therapy every single day, I started to feel relief. I thought that I was tripping. I thought that it was just for the day. Maybe I just got that extra amount of rest. I have been off of work for 4 months now. Okay, so it could take a while. Don't believe these videos that say quick fix in 30 minutes or in 1 minute. It's not going to happen like that. It's going to take time. Listen to the people who tell you the truth. It's going to take time if you have been dealing with chronic foot pain. Okay, I promise you, I will not give you bad instruction. Now, everything that I tell you is education only from my own experience, and I've had long-term chronic foot pain. So I'm telling you, before you do surgery, don't forget to get your MRI, because your MRI is really going to tell you what's wrong with your feet. An x-ray, I would not depend on an x-ray, because my first thing that I had done was to get an x-ray, and the x-ray did not tell the whole story. Okay, it does not tell the whole story. So get you an MRI. Get you a good podiatrist that approves you to get an MRI. That will tell you what kind of issues that you are really dealing with. So the MRI, the physical therapy, please do the physical therapy, okay? If I know that it's really hard, especially if you're working full time. I had the same issue, but you know what? Since I've been off, only committed to my physical therapy and recovery, I'm feeling better, okay? So I want to tell you that. Please do the physical therapy. Michigan Foot Doctors, Brad and Bob, physical therapists. You can look them up on YouTube. Ask Dr. Joe on YouTube. All of these people were on YouTube. I have gotten more education and knowledge about my foot condition off of YouTube than I have from my own doctor. And that's not to say anything about my doctor. I have a good doctor. Okay? So I just want to say that if you have long-term foot issues, please, physical therapy, physical therapy, physical therapy. I'm not here to waste your time, okay? Please keep that in mind. give me a like, give me a subscribe to my channel. I have a lot of other things that I was sharing along the way. You can look through my YouTube channel, lots of stuff, okay? You guys have a good day. I just wanted to get this information out to you. So important. I thought that recovery was not ever possible. It is possible, okay? I have been going through this since 2014. I'm a success story. I do have nerve pain though from the surgery. So keep that in mind. I hope this goes away because it's the most annoying pain ever. But keep me in prayer, okay, you guys? You guys have a good one.